My name is Dr. Tom Gallagher. I'm a pediatric otolaryngologist here at the Children's Hospital of the King's Daughters in Norfolk, Virginia. The Aerodigestive Clinic and Aerodigestive Medicine is about the care of children with complex congenital and acquired problems with airway, breathing, swallowing, and growth. It's a multidisciplinary way of approaching children with these conditions. These children are complex, and sometimes it's in the context of having congenital syndromes like trisomy 21, 22q11 deletion syndrome, CHARGE syndrome, but it can also be children with presenting symptoms of stridor, which is noisy breathing, difficulty swallowing or aspiration where things go down the wrong pipe into the airway, feeding difficulties with growth because of feeding and aspiration. We also deal with children with sleep disorder, breathing problems, vocal fold paralysis, which is where your vocal cords don't work properly, or only maybe one side works. We also deal with children with chronic lung disease because of prematurity, extreme prematurity. Aerodigestive medicine involves multidisciplinary care of children with complex conditions, and that involves otolaryngology, or ear, nose, and throat, which is what I do. It also involves a pulmonologist, which is a lung doctor, a gastroenterologist who deals with the esophagus and the stomach and the digestive system, and a speech pathologist. And the four of us typically work together in a combined fashion in one clinical appointment to take care of the child and kind of figure out what the next step to do is and render, a decision about do we need to do any diagnostics or therapeutic interventions. In the Aerodigestive Clinic, the treatments can vary quite broadly. Everything from observation and reassurance to the family that this is a condition that will get better with time, just with observation and follow-up with our team, all the way to a surgical procedure that might be necessary to fix an anatomic problem. And then in between are therapies and medicines. That's the beauty of this clinic, is that we have 4 or 5 providers that can put our heads together to kind of come up with the right plan of action for what we figure out is going on with your child. I think just, the satisfaction of seeing a child come in that was a noisy breather, who had, difficulty feeding or failure to grow, and that child now has resolved those problems. And whether it was just with reassurance and observation, or whether it was with some medical or surgical interventions, seeing that child kind of graduate through our clinic and thrive is really one of the things we enjoy seeing with our patients. Here at CHKD, this multidisciplinary aerodigestive clinic is the only one like it in the state, where you're going to come in and see multiple providers in one clinic appointment, and that's really the standard set throughout the country, and we're following that standard. I'm proud to work at CHKD. I'm part of several multidisciplinary physician teams at this institution. I think they really value multidisciplinary patient care and are setting a standard to do that in the state.